They eventually agreed. Now, the difference in time between the first mammogram and the time I eventually got to do the lumpectomy this time around was I started this journey in January 2022. And it was in April, last week in April, that they took it out. I didn't end there. I was on the operating table and I asked the surgeon, I said, this thing that you took out, with the naked eye, can you see any abnormality here? And he goes, Madam, at your age, your hormones are doing their thing. Don't worry about it. So, well, I want this thing tested. I want it tested. He says, don't worry, you will send it in for tests. And I think he realized this was a stubborn patient and that if he didn't test it, there'll be trouble. He might not have tested it, even though it's supposed to be a normal procedure, but then we know the country we're in. Sometimes if you don't know your rights, things get done. And so obviously he had to send it in for testing. Now to get the test results was another thing. I eventually had to go through the back door about 3 weeks later to get the results, and it came out and it was cancer. It still didn't end there. I picked that up and was like, now what do I do? If the hospitals around me cannot get me a diagnosis without me making noise, obviously these are not the ones that will manage me. How do I treat this? What next? So I went to Lagos and I found my way to a hospital. That's another story. The hospital was set up the year before this diagnosis. And I sent her a message on LinkedIn and she said I should come over the following morning fasting. I came in and ran the whole gamut of tests. We had the blood work. When the results came out, I went in for a CT scan. When I came out, she arranged for a biopsy for me, saying that because by this time it had spread to lymph nodes in my armpit. And while the surgeon that was performing, he asked me, he said, wait, did you say you had a lumpectomy? I said, yes, just 3-4 weeks earlier. And he showed me something on the screen. Apparently, the surgeon did not take out everything. So that was yet another thing. Now, in answer to your question, that's why it's important to know your body. Nobody knows your body better than you. So sometimes you're dealing with stuff and yes, you follow the protocols and you go and get tested, but when something is not right, it is not right. And if you know that in your body and you don't take charge, then you invite cancer cells to spread and do their thing.